You have heard of smile simulations and smile design in dentistry. Perhaps using them in your practice can be very helpful, but it only makes sense when you apply your clinical knowledge to it. So let me give you a case study example. Here, we have a 40-year-old patient whose main complaint was dissatisfaction with the gap on his frontal teeth. I will show you this case on Smilify, which is a smile design platform available on App Store. It allows you to deliver smile simulations within a minute, while next to your patient and on the same visit. Besides being a fast smile simulator, it also helps you and your team better plan the treatment using 3D digital mock-ups. So after doing a clinical exam, there were no need to increase the video, and when it came to the aesthetics, I told my patient that I have a smile simulator that gives them a preview of their future smile. It allows me also to better analyze and understand my patient's wishes as a dentist who not only wants to help him to get the best out of his smile, but also as a clinician that can see not only the teeth that he is complaining, but how the new smile could look like and correlate with his face. So I took a frontal facial picture of my patient, and as you can see, he's looking straight at the lens of the camera, and his head is in a natural physiologic position and is smiling to the camera. This is one of the main purposes of a smile simulation, to visually understand and to be able to educate your patient as you design. On Smilify software, what you see here is a smile frame, which is simply a smile outline where you can move and place it over the patient's existing teeth. It allows you to check on the smile curvature, on teeth proportions, but the main goal of this smile simulation is to motivate and educate my patient on what is the best for his or her smile. The process takes just a minute, so it can be done chair side. All you do is to make sure that the smile outline is in the right position for you to then generate a smile simulation. The smile simulation, as the name says, will help you to show the patient with this visual tool how the new smile could look like before the patient is committing to a final treatment. Even though my patient's main desire is to close the gap, I also want to show my patient how I can go for if I show my patient a different treatment option. A treatment option that goes from second premolar to second premolar. In my smile simulation, I also have the teeth templates. And what I like about it is that you can simulate different teeth shapes within a fraction of a second. And your patient can help you decide what is the best shape for him or for her. Once you finalize your smile simulation, you can handle your iPad, iPhone, or Mac to your patient and do the famous before and after slider. Now with my patient's smile simulation and complementary clinical exams, I am able to either send this info to my lab as a visual reference, or proceed with an in-office digital mock-up. But looking at my smile simulation, and after my patient approves the simulation of his future smile, I can better understand my patient's existing smile curvature and new smile curvature, as well as the proportions from a frontal view. The benefit of creating 3D designs in your practice with Smilify is that it's user-friendly and it has the capability to select from different teeth shapes, export the model so you can print and perform a smile trial on your patient's mouth. For the upper mock-up using Smilify, you will need only the frontal picture of your patient you already have and an intraoral scan. You upload and calibrate the files in the system, and instead of receiving a mock-up that in most cases are made without any facial reference, you design the 3D mock-up and automatically get a visual reference on its progress. Giving you the chance to digitally change the design and make adjustments that best fits the patient's overall aesthetics. Once you're satisfied with the digital mock-up, which in cases like this takes no longer than 15 minutes, you hit Export Model, save it to a cloud software or to your own device, and then take it to a CAM printer to close the model and print. But what if I don't have a printer, you might ask? Simply send it to your lab and they will print it for you. It will still be more cost effective and you'll be more in control of your work. Next, you create a silicone index and apply it into your patient's mouth for a smile trial. Once you print your dental mock-up, notice that the natural morphology will be applied onto it. That's why the 3D teeth templates that you have on your Smilify software already has the natural morphology, which saves you time when performing the buccal restoration for your case. In this stage, you not only check on the patient's approval, but also finalize a blueprint for your final restorations. Here, you apply your clinical knowledge by checking on function, aesthetics, and overall balance. Then you scan the patient with the adjusted mock-up in mouth and send the scan to your lab with the prep scan to use it as a reference for the final restorations. Whether working on composite restorations, veneers, or using a smile simulation and 3D mock-ups to motivate your patients, this program will take you to understand and apply the smile design workflow into your practice so you can create a natural and facially guided treatment plan.